Hi, Assalamualaikum and good morning. We are from Group 1 that will present about Clostridium botulinum.
Before we start, I would like to introduce my group members. Here we have Alia Maisara, Raihana Azra, Putri Sarah Nurin, and Sharifah Nur Shazwani. What is Clostridium botulinum? Clostridium botulinum is a bacillus bacteria, means it's a gram-positive and a rod-shaped bacteria. It is an obligate anaerobe where it requires no oxygen to grow. So, if there is any oxygen present, it can become stressed and produce spore. It also a multibacterium. And where we can find it? This type of bacteria is widespread, where it is actually worldwide and can be found everywhere. Clostridium botulinum can produce botulinum neurotoxin from the spores, and it is actually the most potent toxin that has been discovered. It can cause botulism, a neuroparalytic condition, and there are certain conditions for spore forming. As mentioned previously, Clostridium botulinum required no oxygen at all, and if there is something that causes stress to the bacteria, even some oxygen, the bacteria will sense it and produce spore to protect itself for future generation. Other than that, it is sensitive to warm temperature, which 25 to 37 degrees Celsius, and acidic water, where the pH is above 4.6. What botulinum toxins can do? It inhibits acetylcholine release at the neuromuscular junction. These toxins have 7 types, and they are produced by different types of strains of Clostridium botulinum. Type A, B, E, and rarely F cause human botulisms. Type C, D, and E cause illness in other mammals, birds, and fish. Human botulisms may refer to foodborne botulisms, infant botulisms, wound botulisms, inhalation, and iatrogenic botulisms. Botulisms, especially foodborne botulisms, is often underdiagnosed as the initial symptoms can be confused or overlap with certain neurological disease, such as myasthenia gravis and Guillain-Barré syndrome.
The most common form of botulism is foodborne botulism, which happen due to consumption of contaminated food. Toxin type A, B, or E will be produced in food due to low oxygen content and suitable environment for the growth of bacteria. Symptoms begin to show 12 to 36 hours after toxin gets into the body. This form of botulism mostly happen in lightly preserved food such as asparagus, green beans, corn, and inadequately home-canned food with low acid content such as fermented, salted, or smoked fish and meat products.
For foodborne botulism, it has a prodromal symptoms, which is a nausea, vomiting, diarrhea, constipation, dry mouth, and sore throat. Other than that, it may have a symptom like dyspnea, shortness of breath, respiratory distress or failure, weaknesses, vertigo, diplopia, or dry eyes. And also have a ptosis, droopy eyelid, and it potentially fatal disease characterized by cranial nerve palsy and descending paralysis. The fatality rate is 5 to 10%.
Babies under 6 months are exposed to infant botulism, or also known as floppy baby syndrome. It occurs because bacteria spore get into their intestine and make toxin type A, B, E, or F. The incubation period is 3 to 30 days, and it mostly happens when baby consume honey or corn syrup that are exposed to salt contaminated with bacteria. This type of botulism rarely happens to adults because natural defense in intestine develop over time to prevent germination and the growth of bacteria.
Symptoms for the infant botulism is constipation, anorexia, poor feeding or sucking, loss of head control or tone, drooling, and weak cry.
Another common form of botulism is wound botulism, which happens when spore enter an open wound. Symptoms takes up to 2 weeks to appear, and it commonly happens due to injecting drugs such as black tar heroin.
Wound botulisms have similar symptoms as foodborne botulisms. However, there is no prodromal gastrointestinal symptoms. That doesn't happen here because those Clostridium botulinum spores are not making it into the gastrointestinal tract. So it makes sense that wound botulism should not have GI symptoms. Botulism doesn't have fever, but with wound botulism, it may have fever as it is more likely due to secondary infections. Means it is because of other bacteria that enter the wound and not because of the Clostridium botulinum spores.
Inhalation botulism can only be happen in laboratory setting where maybe there is accidental event result in releasing toxin of aerosol. Symptoms visible between 1 to 3 days. Patient will need to be decontaminated immediately after the exposure. Another rare form of botulism is iatrogenic botulism, or well known as Botox, that happen because too much botulinum toxin injected for cosmetic reason to remove wrinkle or for medical reason to treat migraine and headache.
Nuts. Pathogenesis of botulism. Botulism is a rare but serious illness caused by the release of botulinum toxin that attacks the body nerves and causes difficulty breathing, muscle paralysis, and even death. This toxin is made by Clostridium botulinum. So, here are some explanations on how the botulism develops. Firstly, botulinum toxin is released and transported via bloodstream to peripheral cholinergic nerve terminals. Then, it will bind to presynaptic neuron, which contains acetylcholine vesicles and SNAP proteins. To add on, SNAP proteins are essentially used to mediate vesicle fusion of acetylcholine into presynaptic neuron membrane. Nuts, vesicles that contains acetylcholine cannot fuse into presynaptic neuron membrane and release out acetylcholine. Acetylcholine are not able to bind to acetylcholine receptors, which are presented on skeletal muscle. As we know, acetylcholine is a chemical compound that gives chemical signal to perform a physical activity. Hence, no muscle contraction or movement occurs. For a clearer view, this is a diagram showing the difference between normal mechanism and abnormal mechanism with presence of botulinum toxin.
I'm going to continue the presentation. Before that, I am sure now you have enough exposure of how serious and dangerous botulism can cause to human. Worry not, there is a way to treat it, but it may take patience and time to recover from it. So, I will talk about the treatment of botulism that caused by Clostridium botulism. First of all, I will start with antitoxin, the main treatment for botulism. What is the use of antitoxin? It is a toxin that is moving through your bloodstream to block the toxin's activity in your bloodstream. Keep in mind, it cannot reverse the damage that is already done, but the nerves capable of repairing themselves and to stop the symptoms from getting worse. So, who is this for? It is for people that suffered early foodborne or wound botulism. By injecting antitoxin, it can lower the risk of complications. What is the result? Actually, many people recover fully, but as I said, the recovery takes months and typically involves extended rehabilitation therapy. Next, antibiotics. It is a common medicine that we heard and most taken by human, but in treating the botulism, antibiotics are specially for wound botulism only. If it's used for other type of botulism, it can speed up the release of toxins in the bloodstream. So it is like adding fire to the fuel, and we wouldn't want that, right? So, how does it actually works? Antibiotics important to keep the infection from coming back. You will need to undergo surgery to remove the contaminated part where the bacteria has infected the tissue, and this is where antibiotics will take place. In some cases though, patient will need to aid with breathing assistance. This is because the botulism has seriously affected their muscle for breathing. The patient need to hook up to mechanical ventilation machine as known as ventilator to help them breathe. For this case, depends on the severity, patient will be on ventilator until any paralysis affecting their breathing goes away. Some took months if the illness is severe. Last but not least, therapy. It is part of important treatment to help you recover as you get much better. This therapy is to help patients to improve in their speech, swallowing, and other function affected by botulism.
Botulism appears to be very uncommon in Malaysia, and there is no reported cases in past 10 years. However, in Malaysia, food poisoning incidences are certainly not rare. Malaysia's hot and humid climate easily enhances the multiplication of microorganisms. And one of the microorganisms that very common causes of food poisoning is Clostridium botulinum. In 2016, food poisoning cases in Perak have reached an alarming level with 45 cases reported to date. 887 of the 1,263 victims were students from 32 schools statewide. 70 students of Sekolah Menengah Poilam in Lahad, 52 male students at the Gopeng Matriculation College, 53 students at the Malay College Kuala Kangsar. In these cases, former Malaysia Medical Association President Datuk Dr. Tamasilan said, other causes of food poisoning included bacteria, viral or parasitic agents found in improperly canned commercial food items, meat stew, raw or undercooked seafood. And as we know, the growth of the bacteria and the formation of toxin that will occur in inadequately processed, canned or bottled products are from Clostridium botulinum.